So let's start with the advanced applications of anterior direct composites. In these lessons, in this first part of the lessons, we are going to cover basics aspects of why do we want to first get good restorations? How do we get good restorations? There are key components when we do resin composite restorations that will help us to create exceptional restorations. So again, for today, I'm going to tell you what I know, what I believe, what I do at the University of Iowa, I do in my practice, what I teach to the students. No alteration. Probably this is redundant, but there is no alteration, no photoshopping of any of the images. And it's all the work that I've done in my practice. Hopefully you will enjoy all these cases. To me, always the most important in every talk that I do, in any hands-on exercise that I do, is that I can teach you something that you can use in your practice tomorrow. Can I give you that tip, that technique that really helps you as rewarding for you and rewarding for your patient? And obviously, as a dentist, we really want to benefit our patients. So eventually, it's the patient that benefits with all this good work that we do. So again, what do we need to do? Good composite restorations. We're going to talk about shade selection, and a part of it is divided in shade selection. Then we're going to talk about layering. We're going to talk about cavity preparation, and then contouring, polishing. So step by step, so we'll show all this. So let me show you the type of restoration, type of cases I see in my practice. Okay? So I can show you a case like that. You can see a central incisor that is dark as an old restoration. It's a very young patient. It's a 12-year-old patient. And of course, the 12-year-old kid doesn't care about his looks. The one he cares about the look of the tooth, it's mom. So mom is the one that comes to me and says, well, I don't like this tooth. Please do something about it. Okay? And I understand there is a lot of ways we can restore aesthetics and function to this particular case. Somebody might say, I'm going to do a crown. I'm going to do a porcelain veneer. Somebody will say, I'm going to do a direct restorations. Well, in this particular case, it's a 12-year-old kid. I don't want to be aggressive. I want to delay treatment. So because of that desire of delayed treatment, I'm going to do a direct restoration in this case. So this is an example of doing a direct resin composite restoration. Of course, we did a little bit internal bleaching, external bleaching, and finally a resin composite restoration. So, but you can ask me, okay, you show me a very beautiful case you've done. Please let me know, what do I need to know to do cases like that? All right, so I believe that everybody that wants to do really good resin composite restorations needs to know three main aspects. One, we need to know tooth structure. We need to know what are we restoring. We need to know the materials we are going to use to restore tooth structure. And we have to know the techniques to use this restorative material to replace enamel and dentin. So let's kind of review a little bit of tooth structure, because again, we need to know what are we replacing. When we talk about enamel and dentin or tooth, really in an aesthetic component, we talk about optical properties, correct? So we know there is a color or shade involved. Teeth have color. Teeth have opacity and translucency. There's not a even translucency or opacity. When you look at that situation, in this particular case of the patient, you see there is areas that are translucent, opaque. You see structure, you see the dentin through the enamel. That's important to recognize these type of situations, this type of anatomy, histology. Teeth has fluorescence. Fluorescence is a property that is absorption of the certain wavelengths and emission of visible wavelengths. It's important, yes, because teeth are fluorescent, and thus our restorative materials needs to also be fluorescent. And there is one more property that a lot of people talks about, it's opalescence. Okay? And opalescence is basically changing the emission of light when it's transmitted versus reflected light. When you illuminate a tooth, it looks kind of bluish. When you the light is transmitted through the tooth, the tooth looks more orangey, more rich in color. And that's important for shade selection, but we'll talk about that later. All right? So looking at a tooth, you can see that it's a very characterized tooth in terms of anatomy and histology, correct? It has multiple shades. Sometimes we like to talk about a single shade, correct? The tooth is an A1, an A2, a B1. When in reality, teeth have multiple shades. They are not only single shade. Teeth has surface texture. I have a lot of patients that come to my practice after somebody's done a restoration, and they complain that the teeth feel too smooth. So a tooth has texture, kind of reflects the light, makes the tooth looks like a tooth. Like we mentioned before, there are some opaque areas, some translucent areas. We can see, especially in the incisal third, that a tooth has a very band of translucent material, not all teeth, but some, a band of translucency and a band of opacity, or the so-called halo, okay, that I call effects too. Sometimes because the enamel is translucent, you can see the dentin showing through that translucent enamel. So that's an example of a tooth that we can see. And if we kind of do a section and see how do we look at a tooth and how that tooth looks like that, is because interaction with the light. Some of the light will hit the tooth, when it's illuminated. Some of the light is reflected. That's when we see surface texture, contour. Some of the light will go through the enamel, hit the dentin, reflect. And that's some of the color comes out from the dentin and reflects it out. Some of the light is going to go through that translucent enamel, and the dentin is going to block some areas. Some of the light will hit the incisal edge. That incisal edge will reflect in different ways the light, and that's the halo. Now again, as I said before, this is a different tooth, and not every single tooth has the same characteristics. If you compare this tooth with the one before, we saw that doesn't have that halo, that translucency. But has other characteristics, has different shades, maybe a little white spots. So that's important for us as a dentist to recognize. So again, the tooth is composed of enamel and dentin. So if we kind of do restorations that are very similar or replicate enamel and dentin, we need to know what enamel brings to the table and what dentin brings to the table in a sense of optical properties. So if we talk only about dentin really gives you the color of the tooth. So the dentin gives the color. The color comes from the inside the tooth. Okay? The dentin is opaque. The dentin has certain shapes, certain forms, the term called dentin and lobes, that's sometimes we see in a patient that sometimes we have to imitate to make a restoration look very nice and natural. The dentin is fluorescence. Remember, we talked about the property of absorbing non-visible wavelengths and emitting visible wavelengths of light. Then the dentin is fluorescent. What about enamel? Well, enamel we know covers the dentin. Enamel gives us the general shape of the tooth, gives the texture, modifies the dentin color. So again, the color comes from the dentin, but the light going through the enamel, picking up that color and taking it through the enamel, it modifies the color. And we'll see that later on when we talk about shade selection and custom made of shades. Enamel is opalescence. Dentin is fluorescence, enamel is opalescence. And the enamel gives us that halo, that white line in the incisal edge that extends also proximally, that makes some teeth really kind of pop to life. I really love that halo in a lot of patients. Sometimes difficult to do, but we'll see how we can do that in later sessions. Right? So we will keep talking about the effect of enamel and dentin in the color of teeth. So we've done several studies at the University of Iowa. One of the students, Dr. Alamari, this is what she did. She measured the color of teeth, correct? And then some of those extracted teeth, then she measures the color of the dentin. So what is the effect of it? So we realized that the dentin is higher in chroma. So again, dentin is the highly chromatic. The color comes from the inside. And dentin is also higher value. We also believe that always dentin is low in value, but dentin is higher in value. Because probably it's because it reflects more light than the enamel. Enamel tends to reduce the chroma of that dentin and reduces the value. So those are important considerations when we select shades and when we do our build-ups. And you will see in the future sessions that when we build a tooth with resin composite, we layer it, meaning we'll replace dentin with a dentin-like material and replace enamel with an enamel-like material. So just a little more information of enamel and dentin. I would say enamel is about 70% translucent in general terms because with age it changes. And then it is about 50% translucent, meaning enamel lets 70% of the light go through, and dentin 52% or 50% of the light go through in a certain thickness. Of course, the thicker the material, the less light is going to go through. Age is important consideration that we need to pay attention to, because when I'm looking at different patients, there is age-related changes in the enamel and the dentin that affect the color and opacity and translucency of a tooth. In general terms, young teeth are very opacious and whiter. As we get older and the tooth get older, becomes more translucent. So if the enamel becomes more translucent, then that chroma shows more through that enamel. So the dentin becomes also more translucent. So those changes occur. So we cannot say that enamel is always the same and dentin is always the same in the optical properties. Changes through age. So that's a difficult as a dentist because it's a moving target when we have to select the shade or select what dentin, what enamel. We'll talk a little bit later, right? So now we discuss a little bit to the structure. What about the materials? Well, there is a lot of materials in the market. And I always ask the question from everybody, what is the best material out there in the market? In reality, I'd be hard-pressed to say there is a bad material in the market. I believe there is a lot of very good materials in the market. Everybody has their own favorite. I have my favorites. I can tell you that at the University of Iowa, what I use in my practice is a material called Filtex Supreme Ultra from 3M. I really like that material, and that's what we teach the students. And the cases you will see today are done with that particular material. But again, everybody has their favorites, and there's not really a bad material nowadays in the market. The technology is about the same. Particle size changes a little bit, but in general terms, all resin composites are pretty much very good materials. So what do I say to people about your material? What I say, you have to know your resin composite, because more important than which material is the better one is that you know the material you're using. Okay? So what does it mean? There's a few different things we need to know. Nomenclature of the material, the shade, the opacity, thickness handling. So let's discuss a little bit this. What do I mean with nomenclature? What does it mean, nomenclature? Well, most manufactured materials will have three different types of materials. I mean, by optical properties, meaning they have dentin-like materials, enamel-like materials, and clear, incisal, translucent materials. Obviously, the dentin-like materials are to replace dentin. The enamel-like materials is to replace enamel. And the translucent or incisal material is to create that band in the incisal edge of translucency. Okay? But not everybody calls the materials dentin, enamel, and translucent or incisal. You have to, for the material you have to know what the manufacturer intended it to be. Because the dentin-like replacements, they can be called dentin, opacious dentin, opaque. But again, the nomenclature is something, but you have to realize what that implicates. What does it mean? Meaning all this name is for you to use as a dentin replacement. The same with enamel. Some materials are called enamel, base, body, when in reality they are kind of materials that simulate enamel. And a little easier with the translucent materials. Some of them are incisal, they're called translucent. It's a little easier. Again, know what is the intention of the manufacturer for you to use. Just an examples. And you can see one example here is Filtech Supreme Ultra. They have 4 opacities. They have a dentin-like opacity, a body opacity, that is something in between the dentin and the enamel opacity, and some translucent. Most companies, like I said before, they have 3. So for example, if you look at material like StereX, they have a dentin opaque shade. They have regular body shades and translucent enamel shades. So nomenclature is a little difficult, but in reality, these dentin opaque shades replace dentin, these regular body shades replace enamel, this translucent enamel shades is to replace incisal. And we can give, every company pretty much have different types. Again, remember what is the company meant for you to be used. That's very, very important. What about nomenclature? What about other types of nomenclature? No, we know dentin-like, enamel-like, but there is also some companies that call it different, right? Like an example, this one, they call it dentin enamel translucent. There's kind of the Vita nomenclature. But some companies, they have non-Vita nomenclatures. They have different names like Perfrost, Milky White, if you talk about a material like Ultra Dent. So it's a little more difficult to understand what exactly it means, but read the instructions of the manufacturers. They really tell you what exactly it means. Okay? Shade. This is a very important one. Every dental company will tell you that they really match the Vita Pan shade guide. And that's what we know as a dentist. In dental school, we always been told the Vita Pan, we've been told Vita Pan Classic. At least you are my age, older, you definitely know this. Nowadays, maybe it's a little introduction of different shade guides like the 3D from Vita, but this is kind of the standard. And dental companies manufacture resin composites. This is what they're trying to match, the Vita Pan shade guide. So, long time ago, when I was a resident, I was having trouble matching shades. I would select my shade with the Vita Pan shade guide, and then the shade at the end wasn't precise, wasn't right. And I keep asking myself, what am I doing wrong? What am I doing wrong? So we decided to do a study or just look at different materials. And we tried to find out all materials in the A1 shade that they say was Vita Pan A1 shade. So we made discs, approximately 10 millimeters in diameter and 2 millimeters in thickness, okay? And we photographed them. And this is what we found. So all those that you can see in your screen are A1 materials. So you realize that in this example, you're using the darker shade, and you selected A1, your final result is going to be dark. So the lesson here is that not everybody, not all companies, match the Vita shade guide. And that's something that is very important for us. And later on, you will see that this is one of the reasons why I have a custom shade guide to select the shade when I'm using resin composite. I never use the Vita Pan. Now, materials over the years has become a little bit better, but still, A1 for every company is different. And the reason because it's different is because when you look at the Vita Pan shade guide tab, the color is not uniform. You have a cervical is different than the middle and different than the incisal. So, depends. Some companies might match the cervical area, some companies match the incisal, some companies match the middle, the tooth. That's why the wide range of A1 shades, A2s, and applies for every single shade pretty much. In terms of fluorescence, materials are very fluorescent nowadays. Some of them are a little more than less. But through the years, this was a big deal maybe 15 years ago, 20 years ago. But nowadays, I believe most materials, maybe one or two, might not be almost perfect fluorescence of the dentin. So just a couple of examples we can see there. What about opacity? Well, opacity is similar to shade. When you look at the opacity of different materials, you find out that different materials have different opacities. All right? We talk about an opacity of enamel to be around 70% and enamel dentin about 50%. But again, with age, this changes. So there's a wide range of translucency of opacities. You can select different materials and measure them, and really some of them are close to the average, some are not close to the average, but not necessarily that's what is the most important. Because again, we in our most practice will have younger patients, older patients. Most important is that you know your material, get yourself familiar with your material. Something that is also very important when we talk about composite is your thickness of your layers, right? Composite materials, as they become thicker, they increase in opacity as expected, and also there is an increase in chroma. If I will make discs of increasing thicknesses, this is you will see an increase in opacity and increase in chroma. Now, when you start layering materials, becomes very different. I can layer a disc of 1 millimeter of enamel and 2 millimeters of dentin. Or I could layer a different one with a thicker enamel, 1.5 millimeters of enamel, and the same amount of dentin. If I will look at them, enamel layer, different thickness of enamel, you will see different colors, different appearances, and that's also important. So for a long time, we know that the thickness of our layer is very, very important. So even though you might use the same dentin and the same enamel, if you change the thickness of your enamel, it will change the final appearance, color, translucency of your restoration. Dr. Jordi Manauta from Italy, he went into this quest to try to find out what was the best thickness of material. And they came out to the conclusion after doing different thickness of enamel over dentin that really the ideal thickness for enamel was 0.5 millimeters. So in my practice, this is what I try to do with resin composite restorations that I layer. I will always try to have 0.5 millimeters of the final layer of enamel. Okay? But it's very difficult to come up with always consistently 0.5 millimeters of enamel. There is a group called Stal Italiano that they developed this instrument. This instrument is called the Misura instrument. So these instruments allow you to precisely measure or have a final layer of 0.5 millimeters. And when you see the hands-on component, I'll demonstrate this instrument to consistently get the same thickness of enamel. There's two ends to the instrument. One has the longer 0.5 millimeter marker and the other one is smaller, but we'll see that later. Handling is also very important with materials. Some materials are sticky, runny. Some materials are more like we call a waxy consistence. You can grab with your fingers, you can do it shapes. They're not sticky. I particularly like materials that they're not sticky, that I can shape in the mouth. So that's something that is different for everybody. Somebody likes different things. Like everybody likes different instruments, everybody likes different consistencies. I particularly like the consistency of Filtech Supreme Ultra, the one that I used at school. It's very nice for me. So now, what else do we need to know to do good composite restorations, the techniques? Okay? And we are going to go pretty much step by step to this process, and then probably in the next few sessions. So we look at, in this session so far, we look at two very important factors to do good resin composite restorations. First, we look at the structure, enamel versus dentin, their composition, their physical optical properties. And then we look at the materials, knowing all materials are pretty good. In the next sessions, we will do then the step-by-step. We'll continue with chase selection, will be the next. Hopefully I will see you in the next section.